And I must say, especially the love of my children. I mean, as you know, when you have a child
Yes.
coming, you just can't believe how much you love them. And so my first son is just like that. I can't believe how much I love him. And then the second one comes along, and you just think, well, there's no way. I love this one every bit as much. And then the third one, I'm ready for it now. I love him every bit as much. So it's like infinity plus infinity plus infinity. And at that time, I just, even though I wasn't really faithful in any way,
Hmm.
I just intuited that I was tasting of the divine love, really. And so these sorts of experiences, I mean, were pushing me along towards theism and
Hmm.
ultimately towards Christianity, ultimately to Catholicism.
Hmm.
Um, there were big moments in that. I would say one thing though that's really important is that it was patience. I mean, so many patients reached out and befriended me. And you
Hmm.
would think that a patient would be just, deep in a hole having a cancer diagnosis.
Hmm.
But what I found so many of them did was reach out towards me and befriend me for some reason, for no other reason than kindness that I can tell. And I remember my first patient who actually became a friend.
Hmm.
I'm interviewing her, and we're just talking about her diagnosis and treatments, and she just stops at some point and sits on the edge of her chair and just says, "Dr. Collins, are you a Christian?"
Hmm.
I mean, I promise you, I'd never been asked that question before by a patient or really anybody. And it really struck me. And I had to say, I'm seeking actually, and I'm open, but